Hundreds of people joined a devastated family in Alabama yesterday to say goodbye to 9-year-old Mackenzie Adams. The little girl, she took her own life earlier this month. Her family says she hanged herself after several months of bullying for being friends with a white student of all things. Now, the shocking death of a 4th grader has parents thinking about how to spot warning signs in their own kids before it is too late. Family physician Dr. Jennifer Caudle joins me now to talk about this sad, shocking incident. A 9-year-old we're talking about.
My heart is breaking. Honestly, I read the story and I mean, I'm sure as you and so many people are, I'm devastated. And she's so young.
And the reasons behind this, what are some of the signs, I guess, parents should really look out for?
Yeah.
It's probably likely hard to detect, but...
And sometimes it is. You know, suicide is a really tough thing. It's also something we think of as multifactorial, which means that in the medical community, we think of suicide as having often many reasons and factors, right? There's a lot that goes into it. I think one of the things that makes this particular case so tough for all of us is how young she was. And what we do know is that we actually don't have a lot of data and information on children this young in suicide. So your question is, how would parents even know? Because oftentimes children that are particularly young may not be able to express themselves the way older people are. So what I would say is changes, and I think this is a great full screen that we have up, changes in eating and sleeping habits. You want to look for changes in children because they may not tell you, they just may act differently. Doing worse in school, maybe withdrawing, drastic personality changes. But the thing is also, children this young can have things like constipation, abdominal pain, headaches. Those are what we call somatic symptoms.
So if parents are seeing some of these signs, how should they react? I mean, people I feel like are, don't want to overreact with these types of situations, but then you never know.
Well, that's true. And I think one of the best things that we can do is talk to our kids. And I always say this too is, don't ever underestimate warning signs or even things that your child might say. Don't blow anything off. It doesn't mean that we have to overreact, but it means look into things. It means take children seriously, whatever they say. Talk to them, communicate with them, ask them about how they're feeling. And I think the biggest thing is if you're concerned as a parent and you're saying, gosh, I don't know, is this a problem, is it not? That's when you seek out medical care and medical help, and we can help you with this.
And what about warning signs for adults? Because we've been dealing with this. We've been seeing several people in the forefront. It is most recently Pete Davidson in that post on Instagram. Goodness, he's okay, thank goodness. But what are some of the signs? Are they similar or not?
Well, I think in some ways they may be similar to what we had on the screen. I think with adults, sometimes we see things change in sleep and eating habits, maybe changes in our weight, but also changes in mood, maybe irritability. Maybe we're withdrawing from people. We don't want to be around people. Some people will sleep all day, signs of depression, etc., things like that. I think this is a hard time of year. And I really wanted to say this because this is the holidays. It's a very festive time of year, but it's not festive for everyone. And this can be a particularly hard time of year for depression, anxiety, and even suicidal thoughts because, well, there's just so much going on. So that's why I just say, especially during this time of year, look out for your friends, look out for your loved ones, and, make sure that you're reaching out to other people, especially if you're saying, gosh, I'm just not feeling well. I'm not myself.
Yes, and you know what, too? You can be disguised a lot of times on social media. You see all these great pictures of an amazing life.
Because people only post the best pictures, right? We don't post the bad pictures. And, not to interrupt you, but that's really important. It's kind of looking beyond the social media.
All right, Dr. Caudle, always a pleasure. Thank you.
Thank you.